With patients with MPNs, they really have very significant impact from their disease, both in symptoms and quality of life. Now, these things are complementary, but they're not exactly the same. So when we measure individual symptoms, it's a subjective feeling of whether it's itching, whether it's fatigue, whether it's night sweats, that one can try to quantify. And indeed, we've done a variety of validation work to show indeed that you can both quantify it, it's reproducible, you can see improvement with therapy. Second, there's really health-related quality of life. So first, quality of life is a broad concept. You could be stressed about the economic situation in the world, and that impacts your quality of life. Health-related quality of life is really your quality of life based on where you think you should be as it relates to your health. And that can have implications from financial toxicity to symptoms, to impact, to pain, to hassle of medical care. But symptoms clearly are a very important driver of health-related quality of life. Let's say an individual has really uncontrolled itching or pruritus. That can be very disruptive. It can interfere with sleep. You can hardly do any or enjoy any activity if you have overwhelming itching, pain, night sweats, or other difficulties. So they clearly have a very strong correlation. What we have noticed is that patients with JAK inhibitors really do improve both a quality of life and, of course, with their symptoms. Now, one of the analysis we had done at ASCO had also showed that with the improvement in anemia and transfusions, there was also an improvement using other patient-reported outcome forms in terms of role functioning and physical functioning. These are questions that basically get at, is it easier to live my normal daily life, to go to the grocery store, to attend a graduation, or to go to church if I would so like to do so. So we think a very important tight correlation. Fortunately, our medicines do seem like they're making an impact.